Hello, everyone. This section is zoonotic diseases. So let's go ahead and get that up for you. All right, so zoonotic diseases, again, my name is Emily Nolan. Let's go ahead and dive right in. So what is zoonotic diseases, or what is a zoonotic disease? A zoonotic disease is defined as any disease that can be transmitted from an animal to humans. There are 150 known zoonotic diseases. Personally, I feel like there's more coming out, so keep that in mind as this video ages. However, about half of them are clinically significant. Clinically significant means that those are very common and most possible to be contracted by humans in their everyday work with animals. Vet techs and veterinary staff, along with other professionals that work with animals, need to constantly keep in mind the risks of contracting a zoonotic disease from the animals that they work with. These people need to take extra measures to prevent the spread of these diseases to both themselves, coworkers, and other animals that they work with. If you work in a zoo environment, any of the visitors that come to the zoo, clients, caretakers, anybody else that's working with those animals can also be at risk for contracting these diseases. Why is understanding zoonotic disease important? It's important to understand how the spread of zoonotic diseases are spread, because humans are the main factor that can limit the spread or even eliminate the presence of the disease in the area altogether. Vet techs and other veterinary staff are at a higher risk for contracting these diseases because of their increase of contact with these animals that are ill to give treatment to those animals. Job safety is what it's all about. Making sure that we're safe in our jobs, that way we can continue to provide care for those animals. Zoonotic diseases affect more areas of our lives than we realize. The food we eat that is produced from an animal, meat and dairy. So we have something called the USDA that regulates any type of animal product to make sure that we meet certain standards, to make sure that there is no type of contamination and that you have good quality meat and dairy that's not going to make us sick. Our pets can contract and spread some diseases. So it's important that you communicate with your veterinarian to make sure if you can vaccinate for it, vaccinate your pet for it. If you can put them on prevention, prevent them from it. If they do contract a zoonotic disease, not necessarily that you did anything wrong or that you didn't do everything you could. Sometimes it happens. You want to make sure that you are understanding and asking the right questions to your veterinarian and discussing with your veterinarian how you can limit the exposure to yourself and the other animals that you maybe care for. The wildlife in your backyard is also burdened with zoonotic diseases. So it's really important to make sure that you're safe, make sure you're not taking risks when you handle, urine or feces that may be left behind by a wild animal. Or if that animal has passed away within your vicinity, be careful when you're handling the carcass of that animal. And then just be mindful of that. I'll also keep in touch with your game warden or any of those types of people, animal control, that work with these types of animals, and they use special protective equipment and special procedures to make sure they don't get infected. Some of them are vaccinated for certain diseases that are not those vaccines are not readily available to the public. So it's important to get with those entities and make sure that you are going through the right channels and minimizing risk when you work with wildlife. So some key concepts we're going to go over. These concepts are things that I'm going to talk about during this presentation. And it's important that you understand these key concepts and their definition. So a disease is a disorder of structure or function in the human, animal, or plant, especially one that produces specific signs and symptoms, or that affects a specific location that is not simply a direct result of physical injury. A host, an organism that harbors a pathogen, a microorganism that causes disease in its host. Zoonosis, the spread of pathogens and disease from animals to humans and from humans to animals. Vector, any living organism that carries and transmits an infectious pathogen to another living organism. We'll talk more about that. Vector disease is pathogens or diseases that are spread through organisms carrying the pathogen or disease. A symptom is a sign that points to potential abnormalities in the organism's normal functioning. A risk, the probability or threat of damage, injury, liability, or loss, or even negative occurrence that is caused by external or internal vulnerabilities that may be avoided through preemptive action. Prevention is something we're going to talk about a lot. Methods that exist to reduce the spread of disease. So let's talk about some different types of transmission and how diseases are transmitted. So there's vector transmission. A vector is any living organism that transmits an infectious disease agent from one host to another. So the most common vectors are going to be mosquitoes, ticks, fleas. Those are extremely popular in Florida. There's skeeters everywhere. So it's really important to understand that those are vectors and they could be carrying diseases for your pets, your animals, and you. Fecal and oral transmission. This occurs when an infected animal passes pathogen through its fecal particles into an uninfected animal through its oral cavity. This occurs most frequently under conditions of unsuitable sanitation, whereby a previously uninfected animal ingests contaminated food or water. So we talked about animal health and husbandry before, making sure they had clean food and water, making sure that food and water doesn't have any fecal material or anything like that in there. And that way they're not ingesting that. So all of these topics we're going to talk about, they tend to go hand in hand. This is one of those things. When you have a clean environment, you are preventing disease, you are keeping that animal health at high levels, and you're making a healthy, happy animal. Airborne transmission occurs when pathogens are transmitted through air currents, through spraying of fluids, sneezing, coughing, or raising dust. Unaffected animals can receive pathogens through an entry point on the body, including the mouth, nose, or cuts on the skin. Fomite transmission. A fomite is any non-living substance, clothing, fence posts, a trailer that carries pathogens, transferring them from one organism to another. So this is super important. This is also, in this way, pathogens are transmitted indirectly. We'll talk about that more. So this is super important to think about if there's any type of, your horse cuts himself on the fence post, if there's bacteria on the fence post or another pathogen on the fence post, now that bacteria is in that cut of your horse. A reproductive transmission occurs when diseases are spread through contact of tissue, of bodily fluids in the process of breeding, gestation, or during the giving birth process. Types of transmission continued. So we kind of touched on indirect transmission, so we'll go over this. So direct transmission is from the reservoir to the host. So straight from, so say you had a raccoon that was in the same environment as your dog, so it came straight from the raccoon to your dog by some means of by some type. Depending on the disease, like we talked about before, different types of transmissions. So indirect transmission is from a reservoir via an agent to the host. So such as a vector. So say a mosquito comes and takes blood from me and then takes it to you and then bites you. Now that vector, if I had a disease, is now going to give you the disease through the vector. Other things are indirect. We talked about the fence posts, having the fomites. So a fomite of a fence post. So say I cut my hand and then I rubbed that on the fence post, and then and I had a disease, and then my horse came up, rubbed himself on the fence post, cut his shoulder open. Now that's my old blood that's there is now touching his wound. So now you have indirect transmission from a disease that I had from a fomite to my horse. Those are just examples. Horizontal transmission is one infected individual to another, and then vertical transmission is from parent to offspring. So if you look in this diagram here, you have this nice, lovely lady. She is pregnant. And so vertical transmission means that she's going to, if she contracted disease, she's going to give that to the fetus that is living inside of her uterus. And then horizontal transmission is if she was infected with a disease and then gave it to her husband. That would be the example of horizontal transmission. And this graph is wonderful for how, diseases spread. So just take a look at that when we're all said and done here. Types of zoonotic diseases. So how infectious is it? Means how easily can it spread? So you have different types of infectious diseases. So the first one's going to be communicable diseases, which are extremely contagious disease. So an example of that would be, say, the COVID-19 disease, in which we've been talking about lately. So that one's going to be easily spread from one person to another, or an animal to another. Non-communicable disease is this no spread from a host to another. So, for instance, diabetes is not going to be, so if I had diabetes, I'm not going to spread it to you. So that is a non-communicable disease. What can you do to prevent zoonotic diseases? So back to good animal health and husbandry, it never stops. Clean environment, food and water, that is going to be your main thing to prevent zoonotic diseases within, your animals. This nice pig in the picture here, he is clean. He is in green grass. His environment is nice and clean. So he is a good looking pig and he looks very healthy. And you want to make sure if it's available based on the breed and species that you're working with, make sure that they're up to date on their vaccinations and they're up to date on any medical treatments or any prevention that you can do. Keep accurate records of each animal in your possession or practice. In case of an infection or outbreak, animals and people affected can be tracked. So say I went and worked with pigs in Georgia and then I came back and I said, oh, I'm not feeling good and I think I've got a disease. Then the doctor can go, where did you get this disease from? And I said, well, I worked in Georgia with some pigs. They can go to that farm in Georgia and that way those pigs can get treatment or that issue can be addressed. Quarantine new animals from the herd for 30 days to ensure no disease has spread to the rest of the herd from the new animal. So if you get a new pig, you have 12 pigs and you get a new pig, number 13. You buy this pig, he goes in his separate pen, very far away, definitely spread out. There's no contact between the old pigs that you have, the 12 that you have, and the 13th pig, the new one, for 30 days. And you can document, hey, I got this pig on this date. I did his 30-day quarantine. He got put with the rest of the group on this date. And that way, in case there's any issues, you can say, well, I did quarantine him. He didn't show any signs of illness. And that way we can kind of figure out what's going on. Identify disease transmission critical control points. So these are locations or procedures where risk of disease transmission are high. So you're in different location fence posts for animals, their bedding, their feed troughs. There you have dairy cattle, any milking procedures that you're going to do. Those are locations. Procedures where risk of transmission is high. If you're going from one pen of animals to another and not hosing off your boots or not washing your hands, that is a procedure that you should be doing in order to limit the risk. Frequently evaluate your animals. If you're with your animals every day, feeding them, keeping them clean, changing their bedding, notice, hey, I don't think that, my pigs are healthy. One has not been eating, or it's been sleeping all day, or this is not normal. We talked about normal animal behavior. It's not normal for them. This is an illness that we need to address. Any illnesses should be treated right away, and necessary precautions should be taken. So if you notice that there's a sick pig, you need to take that pig and put him back in quarantine by himself. Abnormal behavior can be signs of illness. Cuts on the skin or other injuries can lead to greater diseases and transmissions, like I talked with that horse. You want to make sure you clean out those injuries, make sure that they're washed good, that they have, been disinfected with alcohol or iodine, and follow any other directions from your veterinarian. What is the best way to make sure that you are cleaning out and making sure that those skin breakages or injuries are handled and taken care of. Now, how do you prevent yourself from a zoonotic disease? Because there's two parts to zoonotic disease. There's the animal, and then there's the transmission to you. You are part of it, so you got to make sure that you're protecting yourself. So most importantly, we've talked about this so much with COVID, wash your hands. Don't go touch one animal and then not wash your hands and then touch another animal, because now you're spreading disease. Wear the correct PPE. PPE is personal protection protective equipment. So gloves, face mask, eye protection, gown. Make sure that you're wearing the correct ones for the correct situation. If you're in a research facility and you know these animals have diseases because you're researching them and you're trying to figure out how to treat them, definitely wear everything that they tell you to. If it's your pets at home, those are some things that you can kind of pick and choose if that is necessary, but still want to be clean. If you're going to wear the same pair of boots, make sure you wash them. Each environment requires different varieties of PPE, so figure out what is necessary or what's appropriate for that environment. Keep all injuries clean and receive medical treatment from a human physician. So, you may get bit or you may get scratched or anything like that. That's normal. That happens when we work with animals. It's just part of life. So we want to make sure we clean out that area with soap and water. Make sure you get some type of disinfectant, rubbing alcohol, iodine. Normally we recommend Neosporin, some type of topical antibiotic, but definitely, no matter what, consult with your human physician as to what's going to be the best treatment for that injury, and make sure that you're doing the right thing. But definitely your doctor is going to give you the best advice. So be careful and mindful of your actions. So when you think about your actions around animals, does your actions while working with this animal increase your risk of contracting a zoonotic disease? Think about it. If you said yes, you should not do that action. So if you know that it's not necessary and you're irritating that pig and making him more likely to bite you, that's going to be a risk of him when he bites you to give you a disease. So make sure that you are limiting that as much as possible. Back to the whole workplace safety. Report all zoonotic diseases to the correct personnel in order to minimize risk and exposure to the disease, whether that is a governing agency, your supervisor, if that's something you need, if you're in charge of these animal care or these situations, make sure that you are doing the most you can to minimize risk. Wear insect repellent. Fleas, ticks, all of those things, many diseases are spread by those insects. So it is extremely important to make sure that you're wearing insect repellent, that your pets are on, if it's available, flea and tick medication. Cats, dogs, I know for a fact there's flea and tick medication that come in different varieties, and you need to have a discussion with your veterinarian to what is the best option for you and your pets. Be mindful of the food you're eating and how you cook your food. So many dairy productions, products in the US, they are pasteurized to prevent contamination. So just be mindful of that. If you go out of the country, they may not be. Cook meat to the correct temperature. 165 degrees Fahrenheit will kill most pathogens. So if you're cooking your meat to 165 degrees, you know that you're killing most of the pathogens and you're doing what you should to minimize the risk of getting a disease from what you eat. So normally, like I've said before in my other videos, if you have any questions, normally in person, I would just have you ask them to me. However, since we are not in person, please feel free to email me at emily.nolan@famu.edu or give me a call at the UF IFAS Jefferson County Extension Office. I'm here 8 to 5, Monday through Friday. Feel free to ask your veterinarians and things like that other questions. These are some additional resources and good things that I looked into when I made this presentation, and they really helped me a lot. So thank you so much for watching. Ask those questions, talk to your veterinarian, talk to your doctor, really make the best plan you can to minimize risk of zoonotic disease and really take that seriously. So thank you guys for watching. Have a good day.